Bulavinaka, and a big warm welcome to all of those who are tuning into our webinar tonight from all over the Pacific, and a special welcome to our presenter tonight, Mr. Simon Matthews. Bulavinaka, and welcome to our growing group, the South Pacific Society of Lifestyle Medicine. Here in the South Pacific Lifestyle Medicine, we are an organization dedicated to bringing together individuals, organizations to effectively combat the pandemic of non-communicable disease sweeping across the South Pacific. And here we also like to seek and promote the education and training of health professionals in the use of evidence-based approaches to address the root causes of these diseases. And since this is mainly talk of lifestyle medicine, it'd be good for us to review the definition of lifestyle medicine. As we can see here on our screen, it says lifestyle medicine is the evidence-based practice of helping individuals and communities with comprehensive lifestyle changes. Comprehensive lifestyle changes meaning including nutrition, physical activity, stress management, social support, and environmental exposure. This is all to help prevent, treat, and even reverse the progress of chronic diseases by addressing the underlying causes. And we are also having our small growing group is also having a conference that will be held at the Pearl Resort at the Pacific Harbor. And if you have your calendars with you, you can mark the date from the 10th to the 12th of March, 2020. It'll be held at the Pearl Resort. And lifestyle medicine is not only something that is not something new. As you can see all over the globe over here, these are all the places in which lifestyle medicine has given birth, and these are also the locations where they'll be having certification. Yes, you heard that right. You can have certification in lifestyle medicine, and these are the finer details of the dates and the times in which these upcoming certification exams will be taking place in these respective places. And yes, that's a major surprise for our presentation this evening, is that we'll be having the certification board. They'll be coming to Fiji next year on the 13th, and that is just right after our SPSLM conference that will be held at the Pearl. And for all those who are interested, there are different levels of certification. If you want to know more, and if you're interested and you want to be certified in lifestyle medicine, feel free to email us on info@spslm.org, or you can visit our website for more information. Lifestyle medicine is one of the known key things that have helped with non-communicable diseases, and with non-communicable diseases now being responsible for 70 to 80% of all our healthcare expenditure, most health professionals still treat these diseases the same way they treat communicable diseases, and that is with pills and injections. While this might temporarily relieve the acute symptoms, it does not really address the underlying cause of the non-communicable diseases. Most physicians and health professionals receive little to no education on nutrition, exercise, rest, or even social connectivity, which are the four major pillars of lifestyle medicine. And with lifestyle medicine, we learn how to prevent, arrest, and reverse chronic diseases in a scientific, evidence-based manner, and they receive an official seal of approval that you have studied and mastered the discipline from the International Board of Lifestyle Medicine. And this particular board, the International Board of Lifestyle Medicine exam, will take place, as I've previously said, on the day following the South Pacific Society of Lifestyle Medicine Conference. And if you wish to register your interest in this exam, same email address, info@spslm.org. And tonight we will have our presenter, Mr. Simon Matthews, so he will be discussing health and wellness coaching and bringing lifestyle medicine to life. And before we hop on to our presenter, Mr. Simon Matthews, welcome again, and we hope that your message tonight will help us actively live out lifestyle medicine. And without further ado, I'll be handing it over to our presenter tonight, Mr. Simon Matthew.
Thank you very much, Sarah, and Ulavanaka to everyone who's joined in. It's great to be here, and a real privilege to be able to speak to health professionals in the Pacific. Thank you for that lovely introduction, Sarah. We'll be looking this evening at health and wellness coaching, and in particular how health and wellness coaching can really bring lifestyle medicine to life. That the definition you put up is spot on, Sarah, and of course that's the working definition that we use for lifestyle medicine. The other way that I like to think about lifestyle medicine is that people who practice lifestyle medicine, whether you're a physician or a nurse or a dietitian or a psychologist like me, or physiotherapist or optometrist, whatever field of health you practice in, people who practice lifestyle medicine are in the business of health development, health promotion, and health maintenance, rather than necessarily focusing on disease and illness. So we turn things on their head and say, let's focus on what it means to be healthy, not what it means to treat disease. So one of the problems that we have, of course, with our healthcare systems, and this is true not simply in Fiji, but in a lot of the Western and developed world, is that we're seeing this rapidly escalating incidence of non-communicable disease. And if you have a look at that, if you have a look at the graph over on the right, you can see that there's not a linear increase, but a gradually accelerating increase in rates of diabetes in Fiji. And if you look on the left there, you can see the dark blue is in the bottom left of the circle is diabetes, about 16% of the population overall. Cardiovascular disease, about 35%. Cancers, about a bit over 10%. And so on. So the burden of non-communicable disease in Fiji is already enormous. And by comparison, if we choose to look at the Solomon Islands as another point of comparison, you can see slightly smaller rates of diabetes there, around 8%, slightly smaller rates of cardiovascular disease. But if you look at that graph on the right-hand side, you can see that there's an accelerating rate, certainly in women, of non-communicable disease. This graph, which runs from 1980 through to 2014, so about 34 years, appears to show, curiously, and I can't really speak to the reason for this, but a slight levelling off or even decrease in rates of NCDs for males in the Solomon Islands. But for women, it's continuing to increase. So we're facing all over the South Pacific. We're facing considerable difficulties in learning how to effectively manage non-communicable disease and keep our populations healthy, because we all know that we end up in a spiral of negativity with declining health. So people who are less healthy, less able to care for themselves, less able to work, become more of a burden on their communities. That then takes their communities away from the job of working productively to care for people who are increasingly unwell. More of government's budgets go towards accommodating sickness and so on, and we end up in this terribly negative spiral over time. So there's a real sense of urgency about needing to address the increase in non-communicable diseases and find effective ways of intervening. The great news is that we've known for many years that there are lots of aspects of lifestyle medicine which are incredibly effective treatments for non-communicable disease. When we think about what the differences are between caring for people who are unwell and making efforts to keep people healthy, this is what it looks like. So when we're focused on sick care, it means we're managing NCDs. We're also managing the consequences of NCDs, which are things like hospital admissions and comorbidities. We often have pharmaceutically based interventions, and they're very costly. Sarah mentioned, I think it was it 80% of the budget, the health budget, goes towards treating chronic NCDs. So not even early stage NCDs. Healthcare, on the other hand, focuses on the development of good health, focuses on people living well and living healthily and thriving. It supports people to live well with purpose, and that's a really important element of lifestyle medicine. It's relationally focused. In other words, it's built on the natural relationships and connections that human beings love to have. And ultimately, it's less costly and burdensome to community health systems, not simply in the Pacific, but around the world. The other challenge that faces us is that knowing what to do differently from what we're currently doing is typically not the problem that we face. So you would know, as health professionals, I certainly know in my own practice, that every day of the week, my office gets filled with people who sit across from me and say, "Oh, I know I should be exercising more. I know I shouldn't be eating so much processed food. I know I should cut down on smoking. I know I should be drinking less alcohol." People know these things. What they don't know necessarily is how to do this, how to go about doing it. And also knowing why to do it. And the why, as it turns out, is a really important part of health behaviour change, because the why gets at our what we call autonomous motivations, the things that come from within us and make us really, really want to do something different from what we're currently doing. And autonomous motivations can be things like, in my practice, I see a lot of overweight and obese clients. It can be things like being able to run around and play with my kids, being able to get down on the floor with my grandchildren and be able to get up again, or even simply living long enough to be able to see my grandchildren grow up. There are a lot of the whys that people have. So helping people to connect with the why I want better health, and then connecting with how I can go about improving my health, is where we really need to focus our efforts and attentions. And that's where we start to talk about health coaching as an integral part of lifestyle medicine. So health coaching is built on several very robust theories of human behaviour. This is one of them, self-determination theory. And self-determination theory says that human beings have three primary needs. The first is a need for autonomy. In other words, that ability to be able to say, I'm doing this myself and I'm choosing to do this. I'm directing my life in the way that I want it to go. I'm not doing something because someone's telling me to do it. I'm not doing something because I'm fearful of a negative consequence or negative outcome if I don't do it. I'm doing it because I've identified a reason to do it, and I really, really like to feel like I'm doing this. The second part of self-determination theory is competence. So that sense of, I can do this. I have the capacity to do this, and I have the skills to do this, and I have the knowledge to do this. And the third part is relatedness. And that's really, really important in lifestyle medicine. And we really try to capitalize on that to drive home the centrality of the relationships between one human being and another human being, and how that's the basis for us being able to grow and thrive together in our own health and wellness. So autonomy, I want to do this. Competence, I can do this. Relatedness, I do this with other people in my life. Three essential needs that human beings have. Here's the principles of lifestyle medicine, and I'm sure we all know these. Diet and nutrition, of course, exercise and activity, two of the big ones. Social connection and support, there's that relatedness idea that we were just talking about. Useful sleep, I always put the word useful there now when I talk with people about sleep, because lots of people tell me that they get into bed between 11 p.m. and 7 a.m, but that doesn't necessarily mean that they're having useful sleep. Why? Because people are fiddling on devices, or they're watching screens or TV or some other activity like that. that's actually voluntarily distracting them from sleep. So useful sleep is important. Effective management of stressors, learning to respond usefully to the stressors that we all face in our lives. Minimisation of alcohol and total abstinence from tobacco, very important principles of lifestyle medicine. And also, as we now appreciate, health and wellness coaching, which I call the glue of lifestyle medicine. So health and wellness coaching is the thing that connects all those other elements together. And it's the thing that can bring all those elements to life. There's a big difference between knowing what you should eat, knowing how much you should exercise, knowing that being in supportive relationships with others is important, knowing that you should be in bed for 8 hours a night, knowing that it's important to manage stress in your life, knowing that too much alcohol and any amount of tobacco is not good for you. There's a big difference between knowing all those things and knowing how to put those into practice in your life. So that's where we talk about health and wellness coaching being the glue. So I've got a little video here that I want to show you. This is a WellCoaches video that explains very simply, it runs for about 3 minutes, how coaching works. So I'll just let you I'll let you watch this and reflect on it. And if you have questions that arise from this, there's a Q&A box on your screens there. Feel free to type a question in there, and we can come to those a bit later. Hopefully this is going to, oh, here we go. There you go. How coaching works. So one of the things that I invite you to do is to just reflect on what you saw there, and what are some of the principles of coaching that you think were illustrated in that video. So one of the ones that stands out to me is that the person who was in the person of coach never took an expert position. They never stood in front of the other person and said, this is exactly what you should be doing. They supported that person, though, to create their own vision for their health and wellness. In other words, tapping into that person's own why, what this means to me and what really matters to me. Coaching uses the skills of appreciative inquiry, which is a way of helping people to dig into strengths and successes and resources that they have, and identify ways that they can build on and capitalize on those things and generalize those into other areas of their life, rather than getting focused on problem solving a particular thing. It uses open-ended inquiry, so the use of questions and inquiries that allow people to provide lots of information, not what we call closed questions or closed inquiry, which really simply allows someone to respond yes or no. Health coaching helps people to assess their own levels of motivation, and ultimately supports people to make changes through the setting of goals. Number of differences there. I'm not going to go through all of those, but you can see those, a number of differences between experts and coaches. About halfway down, you can see that experts tend to focus on what's wrong and what's not working. When we have our coach hat on, we tend to focus on what's right and what's working, and how we can build on and capitalize on that. So coaching really works with clients to put them in the driver's seat and really engage them around what matters to them. Because we know from our self-determination theory that we saw earlier, when people can identify what matters to them, they're much more likely to feel autonomous about it. And when they feel autonomous about it, they're much more likely to act on it and sustain their changes. So when we talk about open-ended inquiry, we're talking about questions and inquiries that maximize the opportunity for a client to provide information. And they generally start with what, how, when, where, and who. We tend to avoid questions that start with why. And the reason is that often when we ask why questions, it just sounds like we're judging the person a little bit. It can sound like we're standing in that expert position and kind of asking, well, why did you do that? As if we're suggesting that they should have done something different. So there's other ways of asking questions instead of using why. But here's the really important thing down the bottom there. What we explore with open-ended inquiry is values and motivations and goals and dreams and achievements. So we really want to help people dig into their own successes and strengths, the things that drive them, the skills that they have, the risks that they're prepared to take, the rewards they're looking for, the challenges they can foresee, how ready they are, and the possibilities that they envisage for themselves. And we find that when we harness people in those sorts of discussions, it really dramatically opens people's eyes to what can be in my life, and helps them then to set visions and goals for themselves that they will strive towards and will sustain change over. So we're going to have a quick practice right now, and there's a chat function you can see down the bottom of your screen there. It's near the Q&A, and if you use that chat function, you can click on that. It'll open up a box and you can type something in there. So right now, what I'd love you to do is just type in that chat function an example of an open inquiry that you might use in your own practice, whether you're a physician or a GP or a nurse or a dietitian, whatever field of work you are in. just type an example of an open inquiry there and see if you can focus it on things like motivations and values and goals and achievements and successes. So not having it focused on something to do with necessarily a medical problem, but something that might help someone to tap into what really matters to them. So you can just do that over the next couple of minutes while I keep going, and we'll have a look at those. Have a look at those shortly. When we talk about appreciative inquiry, this is what we're talking about. We're talking about a cycle in which we help people to build an experience of positive emotion. And we do that because the research in positive psychology tells us that when we experience positive emotion, a whole lot of things get amplified and boosted for us. So our capacity to become creative increases. Our capacity to become a little less fearful increases. We become just a little more fearless. We are prepared to push ourselves just a little bit harder. When we have experiences of positive emotion, we become what psychologists call more efficacious. We feel like we can do and achieve more. So we go through this cycle of defining what it is that people want to work on, then discovering their successes and their strengths, helping them to dream about what might be and what could be in their lives, helping them to design action steps that will take them towards that, and then helping them to look at where they've got to, the destiny part. Where have I got to in all of this? What point have I come to, and then what can I do to keep moving from here? So you can see when we're talking about, if you imagine this applied to healthcare, we're now talking about a situation in which we're trying to engage people in a really positive, forward-looking, hopeful and energizing discussion about their own health and well-being, and where they would like to see themselves in 3 months or 1 year or 2 years or 5 years with their own health. I'll skip over this slide because I've more or less spoken to this already, but this just talks a little more about what each of those elements focuses on. So when we talk about developing a vision, this is what we're talking about. We're talking about making inquiries like this. What does your health and wellness look like a year from now? How do you imagine yourself a year from now in your own health and wellness? We want to help people find out what their dreams are. And like I said, for some of the people I work with, they're things like, I want to be able to get onto the floor and sit with my grandchildren, or I want to be able to pick my children or grandchildren up, or I want to be able to run around in the park with my children and just enjoy their childhood like they're enjoying it too. We want to find out what their strengths are, what can they draw on to bring to this, what supports they have around them by way of other people, and really importantly, what are some of the successes that they've had? Because if we dig around enough, we've almost always had some success in some area of our lives, and we want to bring that success into other domains. When we're talking about developing a vision, we're asking people questions like, what would you like to be doing consistently 3 months from now? And that helps them to start shaping a goal, something that they're prepared to work on. And then we bring that down even closer to what's something important for you to work on in the next week. So if you look top to bottom there, you can see we're starting really broadly with a vision. What does your health and wellness look like a year from now? Drawing on those strengths and supports and successes, to thinking about what you'd like to be doing differently in 3 months, and then what you'd like to be doing differently in a week. So it's like going down a funnel with respect to time and getting closer and closer to what people can take as a next step. And you can see in this slide that the sorts of questions that we ask can often be really, really simple. They don't need to, open inquiry doesn't mean we need to ask complex questions. We can ask very, very straightforward questions, and that helps people to get to what really matters. And what I'd invite you to do is to look, if you've got a smartphone handy, take a quick snapshot of this screen. You'll get the presentation afterwards anyway. But take a quick snapshot of this screen and then think about some of these questions for yourself in your own life. and see what you come up with yourself. What are you willing to change right now? What are the opportunities that you have in front of you? What are the possibilities that you see? What's the type of plan that you would like to create for yourself in your own life with respect to your health and wellness right now? Really simple questions, but they're incredibly incisive, and they help people get to their truth. In coaching, when we talk about developing motivation, we're ultimately talking about helping people to focus on what psychologists call intrinsic motivation. In other words, motivation that comes from within. And you can see there that when we talk about extrinsic, often that sounds like people saying, I should do this, or I must do this, or I have to do this. When people are being driven by intrinsic motivation, they're more likely to say, I want to do this. So extrinsic motivation can be things like praise from someone else, fame, money, avoiding disappointment. It can be receiving a direction or a request to do something. It can be avoiding a consequence that they're worried about. It can be an attempt to please someone else in their lives. All of those things in extrinsic motivation tend to predict reversible change. And what that means is people are likely to be able to make a short-term change, but they're not likely to be able to sustain it, because the motivation is coming externally. And once it's not in front of them anymore, and they don't see it anymore, it's kind of like it's not there. Intrinsic motivation, on the other hand, is things like feelings of satisfaction, or feeling like I've conquered a challenge, or feeling like I'm having a lot of fun here, or feeling like I've succeeded at something or accomplished something. And the really important thing about intrinsic motivation is that the research shows us that intrinsic motivation predicts sustainable change. People are much more likely to make a change that fits with their belief system, fits with their life, fits with what they want to do, and be able to keep that change going into the long term. And when people get into that state, we call it flow. Flow is a whole, that's a whole other lesson, which I won't get into now. But it comes from the work of a Hungarian psychologist called Csikszentmihalyi. And flow is really that state where the demands on us are very high, and the resources that we have to bring to those demands are also very high. So we're matching the demands on us with the skills and resources that we have. We feel challenged, we feel pushed, we feel like this is a stretch, we feel like we're having to work for something, but at the same time, we feel like we have the resources to put towards it, and we feel like we're succeeding and accomplishing. And that's the sort of experience we want our clients to have in coaching. When we talk about goal setting, we're really only talking about a very, very small part of health coaching. This is a really important point to make, because a lot of people, when they think about coaching, immediately think that coaching means helping people to set goals and work on them. Now, helping people to set goals and supporting people to develop goals that they want to work on is absolutely a part of health coaching, but it's not the main game. It's the, if you like, it's the end point of all the other things that we've done. So most of our work in health coaching is cultivating that significant relationship and connection with someone. It's cultivating the sense of autonomy, that sense of I want to and I can, the sense of competence in someone. It's cultivating the vision or the dream. It's cultivating that connection with strengths and successes that people have had. All those foundation steps in health coaching are really important. If we look at a whole, I haven't got a slide on this, but there's a whole other body of research that looks at what's called common factors. And the common factors research came out of the psychology literature. Well, it started emerging about 50 years ago or more. And what the common factors research sought to answer is the question, what's the best way to bring about a difference in treatment for someone? Is it by, for example, using cognitive behavioural therapy, which you'll be familiar with if you have some knowledge of psychology, or is it interpersonal therapy, or is it motivational interviewing or appreciative inquiry? And the research has been replicated time and time again, and it's consistently shown the same thing, that the most powerful factor in change for all human beings is a supportive relationship with another human being. And that's what sits at the heart of coaching, helping to provide that supportive, engaging, encouraging, warm, compassionate relationship with someone that they can build on to make the changes that they want. So goal setting, we reserve as a small part of that whole process. And goal setting, of course, can focus on things like exercise and activity. We focus on the development of SMART goals, which you may be familiar with: specific, measurable, achievable, realistic, and time-bound. So an exercise goal might be, for example, I will go to the gym for 1 hour to do weight training on Monday, Wednesday, and Friday next week. See how specific that is. It spells out every little step of the goal and makes it very easy then for the person to achieve. And that's what we want to do with goals. We want to make it maximally likely, or we want to make it most likely that people will have an experience of success, because that feeds into their efficacy and their sense of, I can do this. We can have goals around social connection and support. We can have goals around sleep. So I often work with people to construct goals around putting devices away, between making sure that they have a window of the night time where they're available for sleep. We can have goals around effective management of stressors, so doing things that will help people to manage stressors that are different from what they're doing. So often in my experience, people are using food or alcohol or tobacco as ways of managing stressors. We can have goals around minimising use of alcohol or tobacco abstinence. Tobacco abstinence goals are tricky, there's no question about that. All the research tells us this, that people have to typically have several goes at cutting down and quitting smoking before they're successful, but it's worth persisting at. And when we do all of those things, when we combine all of those things that I've been talking about, so the cultivation of autonomy and strengths and visions and dreams and hopes and successes, and we marry that up with the construction of useful goals that people can focus on, then we end up with health and wellness coaching. We end up with someone's capacity to make and sustain changes in their own lives. So one of the important things that we want to do is assess people's readiness for change. Very, very important, because if we set people goals that are too challenging too early, then they're not likely to follow through on them. They're not quite ready for change. And lots of us are like this about lots of things. If you said to me right now, Simon, how prepared or how ready are you to give up eating chocolate that has that nice kind of creamy peppermint centre? I've got to be honest, I would be pretty low just at the moment. I love that sort of chocolate. So if you then worked with me to set me a goal of not eating chocolate for the next week, or eating an apple every night instead of chocolate, I'm going to be honest with you, I would struggle with that goal, because I really like that chocolate. So one of the things we want to do is understand how ready someone is to make a change. We do that very simply with a 0 to 10 scale. So 0 means I'm not at all ready. 10 means I'm ready to start making a change right now. And then we ask people very simply, how confident are you that you can begin making that change? And we intuitively know the answer to those sorts of questions. We call them rating questions in psychology. So if I ask you on a scale of 0 to 10, how much did you enjoy today? 10 being the most. Straight away, you know in your own head a number, and you're all thinking about that number right now. Scaling questions are really easy for people to get hold of, and they provide us with a simple way of assessing someone's confidence to start making change. The next thing that we want to assess in readiness is the importance to someone of making that change right now. So I can be very confident that I could make a change. For example, I'm confident that I could walk 15 kilometres every single day of the week. I'm extremely confident that I could do that. I'm not so sure, though, that that's an important thing for me to be doing right now. So I would rate my importance on that much lower. Clearly, when we're wanting someone to put something into practice, we want their sense of importance of this to be very high as well. So we ask the same question: how important is it to you that you begin doing whatever that is, cutting down on alcohol or increasing your sleep or eating more vegetables with your dinner or something like that? So confidence to change and the importance of the change, when we put them together, help us understand readiness for change. And you can see very easily how we can graph those. So looking up the left-hand side, if someone's confidence is 7 out of 10, and their sense of importance of making a change is also 7 out of 10, that puts them just inside that green square in the top right. In other words, they're ready to start taking some action right now. If, on the other hand, someone says, well, I'm not really confident, I'm about 2 out of 10 confident that I could make a change, and I only think this change is about 3 out of 10 important, you can see that leaves them in the dark blue section down towards the bottom left. In other words, they're not yet ready to start making a change in that area. And that's very important to remember, that we're assessing readiness for change in a particular area, not general readiness for change. So this is a really useful tool to help us understand change. I want to change direction a little bit now and talk briefly about shared medical appointments, which are starting to take hold here in Australia. They're also starting to be deployed in the United States and in England, and it represents a really quite revolutionary way of providing healthcare. So in essence, a shared medical appointment is a way of providing medical treatment to individuals, but in a group setting. So the hallmark of shared medical appointments is that the GP will focus on each person individually, but there are a bunch of other people in the room who are also listening, also learning, also taking in what's being said, and also then thinking about how they can apply that to their own lives. So there's a lot of research on shared medical appointments here in Australia. We have 2 people, Gary Egger and John Stevens, who are really leading the field in the development of shared medical appointments in the world, and they provided great opportunities for patients. Patients really love them. That's what the research tells us. GPs and medical practitioners love them because one of the common complaints of GPs is, I get so tired of saying the same thing 20 times a day to 20 different people. And when you do a shared medical appointment, you say that thing once and 20 people hear it all at the same time. So shared medical appointments really open up the possibility of changing the way that we provide healthcare. And one of the things that we're looking at the moment is bringing health coaching into shared medical appointments as well. So making health coaching an integral part of shared medical appointments by helping people in that environment to identify their strengths, their successes, their visions. What happens when we're in a group and we hear someone say, oh, I really want to reach for something great? Often our response is, oh, wow. Oh, actually, I would like to do that too. So often being in that setting can inspire us to want to reach just a little bit further than we might otherwise. And if we can bring health coaching into that to capitalize on that, then we've got what promises to be a really potent way of delivering healthcare. So in the Pacific, we would probably look at delivering shared medical appointments primarily with nurses. It'd be supported by other medical professionals like a GP. You can have individual meetings when you do health coaching, but you can also have shared medical appointments with health coaching. It would be primarily focused on the management and reversal of non-communicable disease. And we know the research says that NCDs can in some cases be reversed. And if not reversed, they can certainly be stopped in their tracks and the effects limited. And health coaching really then becomes a way of how we interact with our patients, the way we engage with our patients. We also know that health coaching is a great way of guarding your own well-being. And when I talk to health practitioners, whether they're doctors, nurses, dietitians, dentists, all of them say, do you know, when I engage with my patients in this way, I feel energized. I feel like I have a different relationship. I feel like I'm having a more enjoyable working day with my patients. I want to just show you a very quick case study. This is a client of mine, 37-year-old divorced woman. She was originally referred to me by her GP because of adjustment issues in relation to a divorce, which happened several years ago. When she first came in September 2018, she expressed some interest in improving her health and well-being. At that time, she had a BMI of 33. She wasn't exercising. She had very low levels of activity in a sedentary job. She had a poor diet characterised by takeaway food, processed food, high-fat, high-sugar snacks, soft drink for hydration. She had almost no vegetable or fruit intake except potato when I first saw her. We had 6 meetings over 4 months, and she set herself a 5-year vision, which you can see there, spending pleasurable and rewarding time with family and friends in my own house. She didn't own a house at that stage, but wanted to. She wanted to maintain a lifestyle which leads her to be able to engage in activities in life that matter to her. She wanted to maintain an optimistic outlook on life and draw significant meaning from everyday events. When we brought that down to a 3-month vision, she said, I'll be saving money regularly. I'll be eating unprocessed food like whole grains, legumes, vegetables and fruits. I'll be exercising regularly, doing activities that matter to me. I'll be feeling myself getting out of breath. And she really loved that idea that she would be working so hard, she would be out of breath, and prioritising being in contact with family and friends. So that was her 3-month vision. By February this year, she'd largely eliminated takeaway food from her diet. She was planning meals, which she hadn't been doing. She'd introduced beans and pulses into her diet and had cut down on a lot of meat in her diet. She was starting to experiment with spices in her cooking, like cumin and paprika and even chili. And she was active every day by walking. We had a 3-month break while she took some leave. She changed job. Her mother's health, or her mother had a recurrence of cancer. So she had to spend some time caring for her mother. So we ended up with a bit of a break there. But then she returned in June of this year. We've had 3 meetings since. Now she's exercising 3 or more times a week. She actually looks for ways to be active now. So, for example, she takes stairs at work. She looks for opportunities to walk. She's lost 15 kilos since September of last year. So just on 1 year, she got a sense of the joy of food. She eats chicken occasionally only, less than once a week. That's the only meat that she eats. She experiments with new vegetables all the time, and now she's eating beans and pulses as a staple in her diet. And what she's said about what we've done is that she's moved from descriptions of herself as hopeless or she can't see herself doing something to being able to see possibilities. She's able to recognise her own achievements. She's sharing those achievements with her colleagues and her family. She's encouraging her own family members to think differently about their food. She's starting to share recipes, even with her colleagues. Some of those are recipes that I've given her. And she now spontaneously generates new actions and ideas about her own health and wellness. So she'll come up with things herself and she'll say, oh, I could do this or I could do that to change my health and wellness. So, that's a great outcome from someone who's had, only, I think, what's that, 6, 4, 10, only 13 meetings with me over about a year. So an average of about once a month, and she's made tremendous changes. So I've just put this here to emphasize for us that when we talk about coaching and talk about that difference between expert and coaching, we're not talking about throwing expert out the window. We're talking about reserving expert for when we need it. only for when we need it. So we're not coming into an engagement or an interaction with people to kind of download, if you like, all our expertise for them and tell them what they should be doing. We're wanting to engage them in those discussions about dreams and visions and successes and strengths, and add in our medical and health expertise only when we need to do that. So I've called this the not so secret formula to health behaviour change. We start with a problem, whatever that might be in your health. To that, we add some knowledge about what to do, and lifestyle medicine is the knowledge that we need here. Lifestyle medicine really provides us with so many answers to non-communicable disease. And then here comes the health coaching part. The resources, where do the resources come from? Well, mostly they come from within the person. Mostly what we're doing is helping them to identify the resources they're already using in other parts of their lives and to bring those across to their own health and wellness. And then finally, the mindset. And the mindset we want to encourage people is what psychologists call a growth mindset. So not a mindset where we try something and if it doesn't work, we see that as a failure. If we try something and it doesn't work, we see that as something that we've learned. We see that as an opportunity to change our direction slightly or change our course. We simply say that we've learned something valuable from that, and we can now do something different. And when we put all those things together, a health problem, and we combine that with lifestyle medicine knowledge, and we combine that with health coaching that helps to draw out of people their own resources and create in them a mindset for change, then we end up with health behaviour change, which is exactly what we want. So actually, just before let me back up here, and I can see there's a bunch of things now. I'm going to see if I can. So these are some of the open questions that you offered earlier on. So I'm just going to read these to you because there's some fantastic. Oh man, these are brilliant. So I'm just going to read them through. I won't say who's said them, but here they are. What's your reason for getting out of bed in the morning? How good is that? What's your reason for getting out of bed in the morning? Why do you actually not just stay in bed all day is really what we're asking there. Asking someone to dig into what matters to me in my life. What do you see yourself achieving in 2 years? That's a great one. What matters most to you in your life? There's one of those simple, profound questions that helps people get to what matters to them. What matters most in your life? Oh, here's a lovely one. If money was no object, what would you be doing? And that's a great question because people often offer. I'm going to call it an excuse for doing something. So they'll say, "Well, I would do this, but." And if we can what I call front load the question, which is put that little proviso in there. If money was no object, what would you be doing? Then it gets around that straight away and helps people not get stuck on the money, but just dream, think about what they're doing. Tell me about some of the healthy food choices you've made this week. There's a great one. So important because that's not a question, but it's still an open inquiry. It's asking someone just to provide us with information. What would you like to do differently about your fitness than what you're doing now? These are awesome. What do you think's working best for you? That's fabulous. They are all fantastic questions. And someone has asked me here, would these coaching steps work if it was done with a group of people? That is a fantastic question. And the short answer is yes. There's a methodology that we have for deploying coaching in a group setting. So we modify some of the things slightly from individual coaching, but the essence is still the same. The essence is cultivating relationship, cultivating autonomy, cultivating dreams and vision, cultivating strengths and successes, and then working with people to start setting goals that matter to them and that they're prepared to work on. Goals that build on that sense of autonomy, that sense of competence they have, and also their sense of relatedness, their sense of connection to people who matter in their lives. So they are, I've got to say, they are absolutely sensational examples of open inquiry, and congratulations to all of you who provided those examples. They are really, really great, and that's exactly the sort of open inquiry that we make the foundation of health and wellness coaching. So, if you have enjoyed what you've heard this evening, um, I will be attending next year's very, very exciting conference of the South Pacific Society of Lifestyle Medicine in sunny Fiji. And on the Monday preceding the conference, which is the 9th of March, I'll be running a one-day program, Behaviour Change Agent. And this is a one-day program that really fleshes out all those principles that I've talked about tonight, and gives us a model for helping to engage people in behaviour change. It's a day where we get to practice some skills. We get to think about our own visions for our own health and wellness, to think about ways that we can work differently with our clients, and engage them in conversations that matter to them, and help them tap into and connect what really, really matters to them in their daily lives. So that'll be a great opportunity if you have an interest in health and wellness coaching to push your skills along even more than they are. Someone's just asked a great question: what qualifies me to be a health coach? Which is a very, very good question. So in the US, in the United States, health coach is a professional designation. So a lot of medical organisations employ people under the position title health coach. We don't do that in Australia yet. I suspect it doesn't happen in the Pacific. It doesn't happen in New Zealand. We're slowly working towards that. WellCoaches provides a certification pathway for evidence-based health coaching. And so if you take core coaching with WellCoaches, and then continue your learning through some additional experience, and then a process of mentoring and certification with WellCoaches itself, you can then sit an examination set by the National Board of Health and Wellness Coaches, the NBHWC. So those of you who are thinking about taking the IBLM Lifestyle Medicine exam, that's an exam set by the International Board of Lifestyle Medicine. So it's a medical board in the United States, and the National Board of Health and Wellness Coaches is a similarly structured board. So it sets that same high standard for people who are learning in the field. And that's really the gold standard for people who are health and wellness coaches to become certified by the NBHWC. And WellCoaches provides a pathway for people to do that. So that's a great question. So I believe we're out of time, Sarah. And oops, I'm going to. Oh, I don't know what happened there. Let me just try this again and see if. Oh, that's not going to. Oh, I don't know what's happened there. Anyhow, it doesn't matter because we're at the end. So, Sarah, I'm happy to hand back over to you. And yeah. Thank you for your questions, everyone. If you have other questions, I don't know whether if questions come to you afterwards, Sarah, perhaps people could direct those to the SPSLM email, and if they need to be forwarded to me, I'm happy to respond to those. I'm also happy for you to provide people with my email address directly, and they can do it that way.
Well, thank you, Mr. Simon, and for all those who may have other inquiries and would seek to ask Mr. Simon Matthews any other question in regards to his presentation, feel free to email us on info@spslm.org. And if you really are serious about an in-depth discussion about this topic, as Mr. Simon says, he's willing to give his email address out to all who are interested into knowing a little bit more about health and wellness coaching. And we have come to the end of our lovely session tonight, and I believe all those who are tuning in can agree with me that this has been an informative and eye-opener for most of us who play a certain part in in advocating good health and using lifestyle medicine as an avenue to do so. And so we thank you once again, Mr. Simon Matthews, for availing yourself this evening and allowing us to know a little bit more. And just moving, we've come to our question and answer bit of the presentation, but I believe we've covered that as well. But if anyone has any question, as you said, as you said, you can forward it to us on info@sbslm.org, and we will be most happy to inform Mr. Simon of your inquiries. And once again, thank you to all our viewers and also Mr. Simon Matthew for presenting tonight to us. And before we leave you tonight for our webinar, we'd just like to, if you want to help us promote lifestyle medicine in the South Pacific, you can like and follow us on Facebook, Twitter, Instagram, and LinkedIn. Tell your friends, colleagues, all who are involved in the health professional or anyone who's interested in lifestyle medicine to like and follow us on Facebook, Twitter, Instagram, or LinkedIn. And as we've already mentioned, you can become certified in lifestyle medicine. Thank you very much. And to connect with us, these are our SBSLM QR codes. It will be taking you directly to our website and to our Facebook pages. Thank you.